All right. So today, like I said, this is going to be brief, and what we just talked about was wearing masks, and that we have a resurgence of the COVID-19 going on, and what you can do to protect yourself and your children, and also to do your own research and to think about whether you want to send your kids back to school or not. You need to consider the kids' illnesses, but you also need to consider what the adults in the household are challenged with, like asthma, hypertension, um, diabetes, that type of thing. So if you're interested in what you can do to protect yourself from COVID-19, as far as getting your immune system to work at its optimal best, you can look at my video from March the 3rd. In that video, I covered a number of supplements and a number of things that you can do to optimize your immune system. And actually, it seems to have worked for most of my friends and family and any of my former patients that have looked at it. None of them have told me that they have come down with COVID-19. I do have one friend whose elderly mother and other family members came down with COVID-19, and they were able to get well and heal using the regimen that I suggested, even combating neurological effects of COVID-19. They seem to have recovered fully from that. So I'd highly recommend that regimen. And weeks later, after I published that YouTube or Facebook video, there were webinars that were put out by the Institute of Functional Medicine after they had their researchers look at what was effective. And I believe everything that I had recommended was actually recommended by the Institute of Functional Medicine a month later. So my research was sound, and I co-researched it with Dr. Sue Fairchild. And Sue Fairchild put out an ebook about it. So, and I talked about that before. So if you're not aware of that, you can go back and look for that. That was March the 3rd when I talked about COVID, and it's on Facebook, okay? So other health issues that we have going around right now, I think everybody's stressed up in the Northeast after this hurricane episode that we had in the past week. And we've talked about stress before, and this month is, actually it was last month when we were talking about Black mental health. This month we're going to be focusing on digestion. Today I'm supposed to be talking about gastroparesis, actually. And gastroparesis, what that means is it's like it sounds, like you have paralysis of part of the digestion and the gut. And there are a lot of reasons why that can happen. Primarily, it can happen because the nerves that supply the gut are affected. And you've heard me talk before about the autonomic nervous system. The autonomic nervous system is the automatic part of the nervous system, and it controls sleep and digestion. It also controls fight, flight, or freeze. So it can be a relaxation response, or it can be a fight or flight response. From the sympathetic side of the nervous system, the relax, rest, and digest side is the parasympathetic nervous system. So when you have gastroparesis, there's a problem often with the nervous system, and there could be different causes. One of the most common causes that we see here in the United States is from diabetes affecting the nervous system. And I think people think about, peripheral neuropathy with diabetes, but diabetes can affect any part of the nervous system, including the brain, spinal cord, and the autonomic nervous system. Most people that have diabetes have some mild effects on the autonomic nervous system immediately when the blood sugar starts going above a certain number. And you've heard me talk about that before. It causes glycation. What glycation means is that the glucose in the blood that's in excess starts to bind to proteins in the tissues. All of your tissues have collagen and proteins. And when that glucose binds to those collagen and proteins, it causes the collagen and proteins to be stiff. So if you think of the walls of the arteries, like for instance in the heart, those walls can get stiff and hard and not be as compliant. That can contribute to elevations in blood pressure and the formation of plaque on the inside of the blood vessels. So with gastroparesis, so diabetes is a common cause, and then there are also people may be born with defects in the nervous system that can cause gastroparesis, but that's kind of rare. So when people have gastroparesis, some of the symptoms that they may have nausea, they may have vomiting, they may not be digesting food properly. They may have a lot of constipation because things are not moving through the digestion properly. Everything is slowed down because of the paralysis of think of the stomach, it's like this bag, and when things empty into that bag, there are neurotransmitters and hormones that cause contraction of whatever part of the gut where the food or the feces are. And so it's constantly moving things through these miles and miles of gut. And what happens with gastroparesis is it's just a paralysis of that gut wall. So the gut is not moving things through, and things can just sit and stagnate, and literally you can have fermentation going on. The person can have a lot of gas, or you know how cats get these fur balls in their stomach and it can cause things to not move through? The fiber that's in our diet can cause kind of a fur ball to accumulate in the stomach or in the small intestine that can often be seen on x-ray. And that's contributing, or it's a side effect of the gastroparesis that we can see on the x-ray. So I talked about some of the symptoms. Sometimes people can have belly pain too. And they often have a lot of nutritional deficiencies because nothing is getting digested. Things just sit in the stomach for hours and hours. And eventually gravity moves things through, but it moves them through very slowly. So there's delayed gastric or stomach emptying, delayed emptying from the small intestine, and delayed transit through the small intestine, the large intestine. Or it can just be affecting the stomach, but then affect the other areas because it's kind of like a domino effect. If in the stomach, if it's not moving fast enough, or if there's not enough acid in the stomach, the rest of the process is going to be slowed down until elimination. So that's basically what gastroparesis is. What are the treatments, or what are the treatment options? So in conventional medicine, there's really not much that can be done. There are a few medications that are prescribed for different things, like sometimes they'll prescribe antacids or acid blockers, thinking that the person will have less reflux, because it's kind of like things get constipated and then people get reflux or stomach pain or belching. So they may give that type of medication. They may give a motility medication, and these are medications that help to push things through. They kind of stimulate the nervous system. Those can be effective short term. I think long term, they're not as effective. We like to look at the root cause in functional medicine. So what is causing the gastroparesis? Often it may be elements in the diet, it may be nutritional deficiencies, it may be diabetes. What is affecting that nerve, and why is the stomach not emptying properly? So we are going to look at all those different angles, the composition of the diet, how much fiber is in there, because fiber stimulates the gut to move things forward as well. Like I said, the acidity stimulates to move the gut forward, and the nerve stimulation. So we have exercises that we can prescribe that may stimulate the nerve, stimulate the vagus nerve, and stimulate that part of the nervous system, the parasympathetic nervous system, to move things through. And then, what's the ratio of liquids and how much liquids a person's intaking also affects digestion, and can dilute out the digestive enzymes. So we need to pay attention to the root causes, which we do in integrative medicine and in functional medicine. I've seen people that have diagnoses of gastroparesis improve. I've seen some even been able to reverse that process and to get their digestion back. This type of process, when you're talking about rehabilitating nerves, takes months. That's not something that's going to happen within weeks. And it's a multi-pronged approach, because we've got to figure out just overall why the vagus nerve is not working properly. And sometimes it could be sleep apnea that hasn't been diagnosed. I know you probably don't see a connection, but there's a connection between sleep apnea and the functioning of the autonomic nervous system, because actually that can shut it down. Sleep apnea can cause diabetes and hypertension. So it's indirect, but sometimes there are other issues that are contributing to why a person is having problems with their digestion. So I talked about medication. I talked about that with the multi-pronged approach in integrative and functional medicine, we may be looking at first the mental, emotional, spiritual node in the center, affecting all the other nodes. And the mental, emotional, spiritual, I mentioned the sleep, but what stressors are the person under? What is affecting like their mood, because some of the mood disorders can also coincide with, like, anxiety and depression can also contribute or get feedback from the autonomic nervous system dysfunction and sleep dysfunction. So these things are not separate. There are elements in the diet that can also contribute to degrading the nerves, and that would be processed foods, pesticides, herbicides, things that are going to be toxic to the mitochondria, can infiltrate the nerves and affect the nerve function. Solvents, certain industrial oils. So there's a number of things that can, and fuels that can interfere with nerve function. So we like to take a comprehensive look. In people's homes, a lot of people have mold in their homes, and this is where it can have an effect on the nerves. And it could affect this nerve and affect digestion. So all of these things have an effect, and it's worth sitting down with a practitioner like myself and getting some coaching and actually mapping out a timeline and trying to figure out what's going on and what's contributing to the problem. All right, so we're getting close to 12:30, and I'm going to jump on an educational webinar this afternoon. If you have questions, you can post them in the comments. And if you like this video, please like it. If you're on YouTube, please put a thumbs up and hit the subscribe button if you could. And give me some comments, give me some feedback. If there are other topics you'd like to hear about this month regarding digestion, which is one of my favorite topics, let me know. But later this month, I'm probably going to be talking about SIBO, which is an infection in the small intestine, and about yeast overgrowth. I get a lot of questions about yeast, so we're going to talk about that briefly. So I hope you enjoyed today's video. Today's video was about gastroparesis, and if you didn't see the whole thing, you can come back here in a second and see the video posted. And I hope that everybody's safe and sound. Like we talked about in the beginning, we want to keep wearing the mask regarding COVID-19. Keep up your vigilance. Keep taking, especially vitamin C, but the other supplements that I mentioned in the March 3rd video. If you are looking for some coaching, looking for some help in getting your health together, getting on the wellness track, please contact me. Also, if you're interested in getting an assessment of where you are with your nutrition, you can access a test called the epigenetic test, and it contains organic acid testing, and it's on my Regenerate page, which is REGENERATE.PRO/1589. So that's Regenerate with an 8 dash Regenerate with an 8 .pro/1589. Go on click on the buy button there at the top of the page and select the epigenetic test, which I want to say with shipping, it's around $320. Select that. They will send you a kit to your home. You will provide urine for that test, send it back, and the results come back in about a week. And you'll have access to the results online. So it's very nice that you can make a self-assessment. And then if you would like to meet with me so that I can go over the interpretation of the test a little bit with you, I have a special rate, a special for that. And I spend about 20 minutes with the person one-to-one on a Zoom meeting or a telemedicine meeting. So I look forward to seeing you soon. That's a very economical way to get started on your path of wellness and get started on trying to reverse whatever you have going on so that you increase your risk or decrease your risk of getting COVID-19 by addressing your nutrition, specifically personalized for you by testing. All right, so, and that site, I should mention here also, there's an immune tea that's available on that site, and that has been formulated to help with the immune system in combating or preventing COVID-19. So, alrighty, great seeing you here today, and have a great day. I look forward to seeing you soon. Take care. Bye.